In light of the growing public health concern regarding coronavirus, I was getting questions daily on Instagram. Being inundated with the questions and trying to answer them individually, I thought it was time to make a video from a mom's perspective and what steps we're taking in our home to keep everybody healthy. Hi everybody, if you're new to my channel, my name is Jessica and I am a holistic nutritionist. And here in my space, we focus on making videos dedicated to moms concerning all things mom life, whether that's cooking, cleaning, or healthy living. We take all of those things and we make them very actionable here in this space. For starters, I am not a medical doctor. However, I am a holistic nutritionist with a background in biochemistry who has a husband that travels on an airplane every week, twice a week. So I, as all of you, have a vested interest into taking all of the precautions I can to keep my family healthy. Now, the reason I've shied away from speaking about the coronavirus is because it is a moving target, and even some of the information I share today may shift within the coming weeks. Additionally, I hadn't been watching the research that closely, and I only want to share facts here and not create more fear. So with that being said, much of what we're going to cover today is precautions and things that you hear me speak about frequently here on this channel and on Instagram, ways to live a healthier lifestyle even amidst the epidemic. By now, I'm sure you're all well aware of the coronavirus, so we're going to move through this part quickly. So what is the coronavirus? It is indeed a respiratory illness that was first detected in China. You will also hear it referred to by a couple of names: the novel coronavirus, the 2019 nCoV. There's a couple of names, and even you might hear it classified within the same category as SARS. So coronaviruses are a large family of viruses that are named for the spikes on their surfaces, like crowns. So based on the data that we have today, it's worth noting that children, which most of you who watch my channel are moms, do not appear more susceptible to the coronavirus than adults. In fact, to date, in March when I'm filming this, there have been no deaths reported among young children. Additionally, based on the existing cases, it's estimated that about 80% of people who are affected experience mild symptoms. So how is this transmitted? Now it is clear, and the CDC has reported this, that human-to-human transmission is possible and it's occurring, which means it's in its community phase right now. So transmission is mainly through respiratory droplets in close contact, similar to how the flu is spread. So the CDC defines close contact as being within 6 feet or within a room or a care area for a prolonged period without personal protection or equipment, or having direct contact with somebody who may have the infection. Also, we now know that unfortunately, the coronavirus may live on certain surfaces at room temperature. This, with the contagiousness of the virus, is what's causing people to really panic. And because we still are in cold and flu season right now, many of the symptoms are similar to those of influenza, which makes it initially hard to know and detect because they are indicative of the coronavirus and other illnesses. So what are those symptoms? Well, what is important to remember is the majority of infected people, as we spoke about earlier, appear to have mild infections with mild cold-like symptoms. As noted before, there are cases and reports of asymptomatic carriers. However, most people who do come in contact seem to develop symptoms of fever, uncomplicated respiratory symptoms, difficulty breathing, things like cough, sore throat, congestion, headaches, and mucus aches, mild pneumonia, and then of course severe pneumonia, acute respiratory disease syndrome, and then more severe cases can then develop into sepsis and septic shock. So now, what can we all do? Well, first and foremost, we can stay informed. It's important to process the amount of information that we're all receiving in honestly a really thoughtful way, with in mind that worrying and panicking only causes more harm by stressing out our immune system. There's things that we need to do, like boost our immune system now more than ever. It's essential to prioritize our health and well-being and do everything that you can do to boost your and your family's immune system so that you're healthy as possible. So if you encounter the virus, we've done everything we can precautionary. So research is showing that sustaining healthy habits that support immunity can help prepare our bodies to better fight and recover from illness, including the coronavirus. So this includes things like sticking to a nutrient-dense, toxic-free diet, including immune supportive foods like garlic and ginger, and avoiding foods that tend to weaken our immune system, such as sugar, refined grains, industrial vegetable oils, and processed and refined foods as much as you can. Next, we want to get plenty of sleep, ideally 7 to 8 hours a night. This is your body's time to perform maintenance, which bolsters our immune system, and research shows that repeatedly shortchanging your sleep by even an hour or two can negatively affect your immunity. The next thing we want to do is get plenty of sunshine, and if not, as I always recommend, supplement with vitamin D plus K2. High levels of vitamin D have long been linked to lower rates of illness. We talk about this next one a lot here on my channel, but the next thing we want to consider is taking additional vitamins, micronutrients, and supplements that support immunity, such as a high quality multivitamin. You know I love Mary Ruth's multivitamin. I will link that for you in the description box down below. Things like magnesium, which we know is crucial in so many functions of the body. High quality omega-3 fatty acids, vitamin C, zinc, elderberry. Digestive enzymes are an incredible tool. And then of course, probiotics. We know that 70% of our immune system lies within our gut, so focusing on high quality probiotics right now is crucially important. Then we want to move our bodies. Getting at least 20 minutes of low to moderate exercise a day helps prime our immune system. This movement results in the production of more white blood cells, which helps to combat bacteria and viruses, and oxygen, which helps improve our circulation throughout our body. Then, of course, things like practicing good hygiene. These habits include washing your hands frequently with soap and warm water for at least 30 seconds. This, of course, can help protect against the coronavirus amongst other germs, the flu and the cold, all of which things will weaken our immune system and make it harder to fight anything that we come in contact with. Then there's general practices like covering your mouth and your nose when coughing and sneezing, and keeping your hands away from your face, because germs routinely spread when a person touches something contaminated with germs and then they touch their eyes, their mouth, or their nose. And I know this is really hard with little ones, but it's something we do want to be diligent about. If you begin to develop a cold and or cold-like symptoms and become ill, you want to be sure to take care of yourself and minimize the spread to others by staying home and making contact, of course, with your healthcare provider. So now what am I doing specifically to keep our families safe? Well, first, I'm loading up our daily smoothie with foods that have antiviral properties, things like coconut oil, apple cider vinegar, fresh ginger, and I'm using green tea as the base to blend everything together. Additionally, I'm using tons of adaptogens and powdered mushrooms, and I'm including foods like wild blueberries, sprouts, spinach, celery, and parsley. Next, I'm being hyper diligent with our supplement routine to ensure we're supporting everyone's immune system. This includes everything I mentioned earlier in the video, in addition to all of the fresh foods that we have access to in our fridge to stay healthy. While there's still more to learn about the coronavirus, my intent in sharing this video is to provide current and accurate information about a situation and offer pragmatic steps that we can take to keep ourselves and our family safe while minimizing the panic that's spreading amongst us. Now, if you have any questions, of course, leave them in the comment section down below. I would love to keep the conversation going and have an open dialogue with you. I want to thank you all so much for watching, and if you like this video and you like this type of content, it would mean a lot to me if you would give it a big thumbs up and consider subscribing right over here on the screen. I make weekly informative videos a lot like this, and I would love to have you as part of our community, and I hope to see you back here next Thursday.